Welcome.
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 Bienvenidos. Welcome to this year's 2021 Zocaloco. Que se diviertan.
In looking for a new leader at Casa, we set a high bar because for nearly 9 years, Jorge Rio Pedre had done a wonderful job of growing this organization into one that was truly important in the St. Louis healthcare scene. We began to interview people, and when we first met Diego Abente, we knew, at least I knew, from the very beginning that he would be our man. He was experienced, articulate, fluent in both English and Spanish, and had a way about him that suggested to us that he would be a fine leader within this organization. And I think the work he's done in the past year and a half in the face of the COVID pandemic, which was totally unexpected for all of us, has really been a great testament to the fact that Ed Macias and I, who led the search committee, made a good choice when we got Diego Abente to come to Casa de Salud.
Thank you for joining us this evening and for making the time to celebrate yet another year of incredible accomplishments at Casa de Salud. My name is Diego Abente, and I'm the President and CEO of Casa. And today, I want to tell you why I'm so proud of the work that we've been able to do at Casa and what we've been able to accomplish during a year of unprecedented challenges as we've responded to a global pandemic that's affected the lives of each and every one of our clients and that's changed the way that we make people's lives better. I came to Casa with a background and an experience that helped me truly connect to the mission and to the people we serve. You see, my family came to the United States from Paraguay, fleeing persecution and political strife. And soon after arriving, when I was just 4 years old and my younger brother was only 2, he got really, really sick. And we were new to the country, and we didn't understand how to navigate the healthcare system. And to make matters worse, my parents were just learning English, and that made their communications with the doctors that would eventually save my brother's life almost moot. Now today, my brother's thriving, but that experience left an indelible mark on me. And so when I got the opportunity to join Casa to contribute to building a more culturally and linguistically inclusive healthcare system in the city I now call home, I couldn't pass that opportunity up. The pandemic forced us to pivot, and in our clinical program, we quickly moved to provide telehealth services with each patient in collaboration with their medical provider, an interpreter, and a staff medical assistant. And as we learned more about how to safely operate during the pandemic, we totally rebuilt our service delivery model to include telephone, televideo, and in-person appointments. And by year end, we were able to restore more than 60% of pre-COVID capacity, providing upwards of 210 clinical services a month. In December, we piloted an exciting new hybrid teleclinic that allowed patients to come to Casa to use our exam rooms, a laptop, and the internet to connect with their medical provider. This hybrid form of telehealth reduces the technology and health literacy barriers that prevent many at-risk folks from safely receiving care. This was also a year of new and deepened collaboration. We work with local governments to provide culturally competent and linguistically sensitive healthcare information, and we also partnered with People's Healthcare Centers to provide free COVID-19 testing, and with the Walgreens pharmacies to provide free flu vaccines on site. And finally, we continue to work with the State Department of Health and local vaccinators, in addition to our fellow immigrant service providers, to design and deploy inclusive vaccine events. With the unyielding support of our stakeholders and donors, we are committed to applying the lessons learned during the pandemic towards expanding our reach and strengthening our services. My deepest gratitude to you for standing by, standing up, and standing with us as we move forward. Thank you for joining us this evening, and we hope you enjoy the program.
At Casa, we take care of all people, nationalities, that come to St. Louis to make St. Louis their home.
There is a huge gap in our community in meeting the needs of those who are foreign-born and have moved to the St. Louis region, and we're struggling with access to the systems that in the best of situations are hard to navigate.
Father Lawrence Biondi, then president of the university, was excited about this idea and provided a physical space on the St. Louis University campus at a rate of $1 a year.
When we first started, it was just an urgent care center.
In the early days, many people were afraid because they couldn't afford the healthcare services that they so much needed.
And then we listened to what some of those communities were saying, what some of those gatekeepers within those communities were saying, to then try to respond and say, if this is a need, what are ways that we can come alongside you? What are ways that we can really help better our services so that they better serve your community?
Once they knew how embracing and culturally competent we were, people were less afraid to come and see us.
We grew because then the need was there.
We ended up turning into a regular physician's office.
We were unable to keep with the demand that the clinic was generating in terms of referrals.
We added a case management program.
Patients are assigned a case manager who walks them through every single stage of the referral process, including appointment setting, actual navigation, where we go with patients to their appointments in order to be their advocate.
There was a bridge that we ourselves could offer to the larger healthcare system. That really made us much more valuable to the community that we were serving.
We always had trouble getting enough psychiatrists to help our patients that had mental health needs.
We launched the Mental Health Collaborative. Big initiative, required construction, a new building.
We did it in collaboration with a host of other agencies so that Casa de Salud was leading the way in showing how collaboration could really be effective.
They provide healthcare services that meet people where they are. Our immigrant community needs a place where they feel welcome, where they feel heard, and where they feel cared for, and Casa de Salud fills that need.
It is clear that our mission to provide access to high-quality care to uninsured people with a focus on our region's newest immigrants is more relevant today than ever.
It's hard to say what's going to happen to Casa over the next 10 years because healthcare is changing so rapidly and so profoundly. But I know that come what may, the organization is going to continue to do wonderful work.
While we're proud of all that Casa de Salud has accomplished, let's be honest, we couldn't do it without help. And by help, in this instance, I'm talking about financial support. On the screen is a QR code, and at any point this evening, when you feel moved, feel free to pick up your phone, open your camera, and just focus on that code so you can make a donation to help Casa to continue its mission. And while no donation is too small, there have been some really big contributions. Those contributions have been made by wonderful sponsors who really know what community means. Let's take a moment and thank these truly rocking sponsors.
CASA began as an organization conceived by Bob Fox, St. Louis University trustee.
It's on our campus. We've now been partnering with it for over a decade. Its mission is very much aligned with our mission.
There's been a great pride and interest in the success of CASA from the top of the administration. That means the chancellor and the provost, down through the deans, to the faculty and students.
So BJC and CASA have a phenomenal relationship, as CASA does with all the other healthcare providers within the St. Louis region. They are a connector.
It's deeply respected. It's an essential part of the safety net for people in our region who need health care.
Our partnership with Casa de Salud in St. Louis County crosses all of our human services and public health resources.
In the Jesuit tradition, we say we produce men and women for and with others. And that's what those volunteers and employees at CASA are, men and women for and with others.
They truly make a difference in the community. To the people who come as immigrants, who don't speak English, who don't know how to navigate the U.S. healthcare system, who come oftentimes frightened, fearful that they're not going to get the help that they need.
So I was first connected to Nacarit in August of 2020 after a telehealth visit she had with Dr. Goldman. It seems that she had some referrals and some imaging done outside of Casa de Salud.
El año pasado me realizaron un MRI que no tenía nada que ver con mi útero.
Last year I was given an order to do an MRI, and the results showed that there was a very enlarged tumor.
It seemed like she was getting conflicting information, given really long wait times, and she wasn't sure if it was a language barrier difference that she wasn't understanding, or if it was actually this is the expectation of the care that she should be receiving.
En un mes me lo resolvieron.
And what told me that it could be a long wait of 6 months ended up being 8 months. Some providers that my job sent me to told me that it should be better to kind of wait it off. But I had a second opinion here at Casa de Salud, and they told me that it should be taken care of immediately.
We were able to get her an appointment within just a couple weeks at SLU Care OB-GYN, where she had her full physical exam.
Durante la pandemia, que
So during the pandemic, Casa de Salud have been able to help me virtually.
We made sure to request an interpreter so to make sure that no one in her family had to interpret for her and that she was really understanding the information in her native language.
Aunque el Dr. Goldman.
I basically just talked to the doctor once. I brought the records in, they scanned them, he was able to see them, and just with one look, he determined my diagnosis, and I went with my referral.
Once she connected there, she reached back out to me and said was very nervous and very scared because they told her she was going to need a surgery, was going to need a hysterectomy. And because of the pain that she was in, because of her experiences at work, she had not been working consistently and was really nervous about her insurance running out. So her insurance was scheduled to run out by the end of the year, and she was told that it would take 6 months to get her in for the surgery. So that would go past the date that her insurance was going to be covering her care. So this was an urgent matter on kind of all fronts, trying to get her in as soon as possible, make sure she was connected to the surgeon.
Y también una de las cosas que me gusta es cuando me ponen en lista.
A really good feeling that I get is when they tell me that I'm on a task list to wait for my appointment, and when I'm told that, I imagine that it's going to take 4 or 6 months, and then I get a call a couple of weeks later, and it's my appointment time.
Fortunately, we were able to get her in right away for the surgery. Just within, again, another couple of weeks, she had her hysterectomy surgery and follow-up visits with SLU Care OB-GYN.
Y me extrajeron
There
un
was
tumor.
a surgery practice that it was to remove the tumor.
Casa de Salud continued to work with Nacarit and help her with financial assistance, both for herself and other members of her family, to try and help pay for some of those medical bills. And we'll continue working with her until all of her medical issues are hopefully resolved and she is better for it.
Yo primero.
Dr. Goldman has been a really good doctor. My case manager, Ophelia, tremendous. super.
Angel.
She's my angel.
Angel.
Ophelia has helped me with everything. From calling to set up an appointment, to talk to the medical staff, to dealing with my financial paperwork. She's been able to take care of it all.
Salvaron mi vida.
Yeah, it saved my life.
That was St. Louis University's salsa team, Sazon. Thank you for joining us tonight. There's been so much talent, we've had so much fun, and you've brought such energy to this event. You know, those are the same words I'd use to describe our first honoree.
I'm delighted to be here this evening to honor my friend and colleague, Michael P. McMillan. Michael has spent his entire career in public service, first as an alderman in the city of St. Louis, and then as the license collector, leading the department that oversees all businesses in the city. And for the last 8 years, Michael has served as the president and CEO of the Urban League of Metropolitan St. Louis. The Urban League, as you know, serves the noble mission to empower African Americans and others throughout the region in securing economic self-reliance, social equality, and civil rights. They do this work across several high-achieving programs that offer educational and economic opportunities, empowerment, advocacy, and community engagement. Just as Casa de Salud strives to achieve equity and access to health care, Michael commits himself to equity of opportunity. And it's for this reason we honor Michael P. McMillan as a true visionary in the region, and I am proud to introduce him as Casa de Salud's 2021 Visionary Award honoree. Please join me in congratulating Michael P. McMillan.
Good evening, ladies and gentlemen. On behalf of the Urban League, I want to say thank you so much to Casa de Salud for this honor. We are truly grateful for the partnership that we have. We're truly grateful to you for the work that you have done, not only since you were created, but especially in the last year since COVID happened. We are very grateful to your board, to your president, the staff, and everyone that worked on tonight's gala. It is critically important that we all support the mission of Casa de Salud. The work that you do is essential to the growth of the St. Louis region. Here at the Urban League, our mission aligns with yours. My personal mission in terms of my career and what I've wanted to do in terms of making a difference in St. Louis aligns with the mission of Casa de Salud. We are grateful for this honor tonight. We appreciate everything that we have done together and everything that we can do in the future together, because we know that St. Louis is better when we welcome everyone, when every single person, regardless of their ethnicity, their race, their orientation, feels that they have a safe place at the table, that they are respected, that they are appreciated, and that they are a valued member of this community. And that is what Casa de Salud has done since it was created. And that's what the Urban League has done since we were created. So we thank you for this honor this evening. We look forward to working together in the future. And we are exceptionally grateful to every single person tonight that is watching for supporting the mission of this organization that does so much for so many each and every day throughout the St. Louis region. Thank you and God bless you.
Everyone has their own idea of what a superhero is. Here at Casa, volunteers are our superheroes.
They are the ones that are at the front lines.
Being an interpreter or a navigator.
Providing direct services for patients.
And help them navigate that process.
We are so grateful to our superhero volunteer doctors and nurses who donate their time to serve our patients.
it's a really important role, and I feel honored to play that role.
If I've come to know something over the last 20 years of my career, it's that nothing is more important than leadership, and even more so in this time of the pandemic. It's why I am so happy to be able to introduce tonight's Community Champion Award, Dr. Alex Garza, Chief Community Health Officer for SSM Health and head of the Regional Pandemic Task Force.
Good evening and buenas noches. I am honored to receive the Casa de Salud Community Champion Award and gratefully accept it not just for myself, but on behalf of everyone who's contributed to our community's response to COVID-19. It's impossible to sum up in a few minutes everything we have been through in the past 15 months. The novel coronavirus has claimed more than 3 million lives worldwide, 570,000 in the United States, and more than 2,000 in the St. Louis region. So many more were infected and fought off the disease or are still fighting. Every one of us has been impacted. I know that tonight's a well-earned celebration, but I want to take a moment to lift up in our thoughts and prayers the people we have lost, as well as everyone who has sacrificed in this pandemic. Because I wouldn't be here accepting this award if it weren't for the incredible efforts of frontline health caregivers, of medical researchers, healthcare administrators and government workers, support staff, volunteers, and everyone who put on a mask or stayed home to keep others safe. At the worst of times, we came together to fight back and make it better. And that's really what I want to acknowledge here tonight, the power of unity. Now, you're recognizing me as a community champion, and I couldn't be more proud of the work I've been able to do as the head of the St. Louis Metropolitan Pandemic Task Force. In an unprecedented collaboration, our region's 4 largest healthcare systems came together with elected officials, departments of public health, and civic and community groups, including Casa de Salud, to coordinate in our war against COVID-19. We saw a need and felt a responsibility to act in the best interests of our community. We became a source of truth and trust against a national backdrop of misinformation. And recognizing the outsized impact the pandemic was having on the elderly, the poor, and uninsured, and on our communities of color, we reached out to them. Casa de Salud, like SSM Health, where I serve as Chief Community Health Officer, and like the task force, is driven by a higher calling. We believe everyone is entitled to high-quality health care, especially in the time of crisis. And by coming together, we're delivering not only care for the sick, but also coordinated advice on how to protect ourselves and our loved ones. Whether it's in Spanish, in English, or any of the other rich languages heard across our region, we make progress when we speak with one voice. Together, we will usher in better days by advocating and helping everyone to get vaccinated. And that's where I want to conclude my remarks, by looking to a brighter future. Now, I'm optimistic that we will move past this pandemic, having safe, effective vaccines that were developed in record time makes COVID-19 a largely preventable disease. I know we all can't wait to safely take off our masks and to hug and gather in person for celebrations like this one. I'm also looking forward to continuing the collaboration modeled by the task force. I hope that together we can make further progress in improving access to high-quality, affordable health care and in addressing social, economic, and environmental issues that threaten good health. So I wish continued success for Casa de Salud, and thank you again for honoring me with this award. Gracias.
We are very proud to be mask wearers at Casa, and I was the mask enforcer for the most part. So a lot of people probably got really tired of me reminding them to put their mask over their nose or make sure they had their door closed when they were eating. So I know I wasn't everybody's favorite, but somebody's got to do it. Diego, mask.
Sorry, Rosemary. When I arrived at Casa in late January of 2020, I encountered an organization that had experienced tremendous growth in its first decade. And every year since our founding, we have increased the number of patients served. In the year prior to the pandemic, we engaged clients across more than 14,000 services, and the folks we served represented more than 60 nationalities and 30 counties on both sides of the river. And then, just 2 months after my arrival, the COVID-19 pandemic forced us to refocus and respond to our generation's greatest public health challenge.
Our doors were closed for months. And from the get-go, we had to reconceptualize our approach to healthcare delivery.
Right now it's kind of a blur because things were happening so fast when the pandemic hit. But what we did is that we bootstrapped the solution.
We were having to adapt to a whole new way of doing our work, redesign systems from scratch.
In the first months of the spring of 2020, the entire organization rallied its resources to help translate the information we had about this disease into Spanish, into plain language, and distribute it.
I've had to keep up to date with all the CDC guidelines. Every time we learn something new about the virus or we get more information, pretty much guidelines would change.
And one good example of how Casa really deepened its partnerships to extend benefits to our patients and clients was through the Betty Jean Kerr People's Health Centers, who provided COVID testing right here on our site.
The clinic really reinvented itself several times over. And we really started right away, realizing that we couldn't see people in person.
We had to change our appointments and switch them to be virtual.
For months, we were communicating with patients by phone audio only.
And it was just the doctor and the patient and myself interpreting and also helping scribe for the doctor. That wasn't sustainable.
It's very hard to do a complete exam when you can't examine people.
All of our current case managers were also onboarded remotely. This was a big shift from our previous practices here at Casa because most of our case management happens in person.
It took us at least a couple of months to secure a HIPAA-compliant version of Zoom, and it wasn't until July that we had our first telehealth appointment. And that proved to be even more challenging than telephone audio for our patients.
For the clients and patients that we treat, telehealth wasn't just another way of connecting. It presented possibly another barrier to receiving service.
Telehealth has been challenging for most of our patients, especially for the elderly. So that being said, we have to be there with them, step by step, guiding them.
And so to overcome these barriers and ensure that we were providing access to all of our patients, we designed the hybrid telehealth clinic.
It has been such a privilege to observe our dedication to serving our patients. A few months into the pandemic, we came back into the clinic on a limited basis.
It was a little scary at first, but once I got here and put my mask on and knew that my patient was happy to see me to get his injection, it was worth the risk.
They're here in the building, and I'm at home doing a Zoom call. And we can get the physical parameters in those cases. We can get their blood pressure, pulse, blood sugar.
I'm very proud of how Casa took its learnings from the first 10 years of its existence and was able to really confront a year like 2020 and transition into 2021, really being able to provide, originally access to care and now helping people face the extra challenges of the pandemic.
Whether there was a virus or no virus, we're still here to provide health for our patients.
The rewarding part was being able to go through something at the same time as your patient. We're all going through a pandemic and we're all making big changes. So it was a way to really make a connection with patients and the entire community.
One of the most rewarding things about working at a healthcare facility during COVID has been the connection to other healthcare facilities and feeling like we're part of a bigger system.
Partnerships were crucial during the pandemic, not only to survive, but to thrive.
It has been incredible to be part of a team that even though a pandemic happened, we were still able to work together and provide healthcare to some of the most marginalized people in St. Louis.
I feel like our services are needed every moment. The minute we walk in here, we're very needed.
Our patients face so many barriers to accessing healthcare.
Lack of insurance,
cost, language,
transportation,
cultural barriers.
Here, they are welcomed and treated with dignity.
They are heard and respected.
Connected to holistic care.
Our patient-centered approach creates an experience
that is accessible,
that is high quality,
that is provided in a culturally sensitive manner,
and in the patient's preferred language,
that empowers patients
with information and knowledge.
As a result, our patients obtain better health outcomes,
gain confidence in navigating the broader healthcare system.
We ask for your help
in making our community healthier
y derrumbando las fronteras,
in expanding access to healthcare.
Please give.
Please give generously.
Please give now.
Yo no sé si tú, no sé si yo seguiremos siendo como hoy. No sé si después de amanecer vamos a sentir la misma sed. ¿Para qué pensar y suponer? No preguntes cosas que no sé. Yo no sé. No sé dónde vamos a parar, eso ya la piel nos lo dirá. ¿Para qué jurar y prometer algo que no está en nuestro poder? Yo no sé lo que es eterno, no me pidas algo que es del tiempo. Yo no sé mañana, yo no sé mañana si estaremos juntos, si se acaba el mundo. Yo no sé si soy para ti, si serás para mí, si lleguemos a amarnos, odiarnos. Yo no sé mañana, yo no sé mañana quién va a estar aquí. De un café pasamos al sofá, de un botón a todo lo demás. No pusimos reglas ni reloj, aquí estamos solos tú y yo. Todo lo que ves es lo que soy, no me pidas más de lo que doy. No, yo no sé mañana, yo no sé mañana si estaremos juntos, si se acaba el mundo. Yo no sé si soy para ti, si serás para mí, si lleguemos a amarnos, odiarnos. Yo no sé mañana, yo no sé mañana quién va a estar aquí. Esta vida es igual que un libro, cada página